What my poster is describing is a cellular therapy for CLL. So what we're doing is we're taking NK cells from normal donors, stimulating them in the lab, and then seeing if they can kill CLL cells. The idea being that NKs are a really potent immune cell against leukemia, and what's been holding back cell therapies before with NK cells is low numbers and low activity against CLL. This new technique that we're working with can expand NK cells orders of magnitude more than we've seen before with previous technologies, and they're much more active than what we've seen before. So what we're showing here is expansion of these cells, cytotoxicity against CLL cells, and then we're also getting into some combinations in vitro with some of our CLL targeted therapies, in this case ibrutinib. So we've had some previous findings with normal NKs that ibrutinib can have kind of mixed effects, protective against NK cell death, but also perhaps decreasing some of their activities, and that seems to be holding up with these activated NKs as well. But overall, kind of the conclusion of this is that these are really positive in vitro findings for this cell therapy for CLL. So we have a couple of things that are ongoing. One is developing this as an autologous therapy, so taking NKs from patients themselves, expanding them, and then giving them back to the patient. We have some preliminary data from there that's looking very good, basically showing that this can work in either case, coming from a normal donor or from the patient themselves. We're also working on our in vivo modeling with mouse model. It's going very well so far, but also preliminary. And then kind of expanding our work into understanding kind of how are these targeting the CLL cells, why is this looking better than the previous options, and kind of expanding our work with combination therapies.